Hi everybody, this is Dr. Hassan El-Lawati. Today I'll be talking about sick euthyroid syndrome. Now, this is very common and you mainly found it during inpatient. So, as endocrinologist, you may be getting a lot of referrals from doctors referring to you a patient because of deranged thyroid function test. And those patients, they are sick and they are probably in ICU and they have abnormal thyroid function. Now, how you deal with it and how you define what we call sick euthyroid syndrome. Now, in sick euthyroid syndrome, what happens is that you will have less T3 and you will have increase in reverse T3. And that's the most common pattern of it. We call it low T3 syndrome. So if you got a patient in which his T3 level is low, then your suspicion of sick euthyroid syndrome is high and you can request reverse T3 level and you will find it high. Now, sick euthyroid syndrome can behave in a different way. So, in an early and mild infection, the T4 level and TSH level may be normal, but T3 level will be low and reverse T3 level will be high. If the infection is very severe and prolonged, like for example, if the patient in ICU with septic shock, then you may expect that T3 and T4 and TSH, all of them low with high reverse T3. So this is just a brief idea about sick euthyroid syndrome, and you need to, whenever you get such situation, it is very highly recommended to repeat thyroid function test later on to make sure that you are not dealing with any thyroid disorders, but instead sick euthyroid syndrome, as you expect normalization of thyroid function test during follow-up in sick euthyroid syndrome. Sick euthyroid syndrome does not require any management. You just need to observe the patient and follow them up. Thank you. If you have any comment, please write them down. Thank you. I'll be so happy to answer those questions.